Hey everyone, this is Lindsey.Boes with Boes Therapy Services based out of Littleton, Colorado, and I'm really excited about this video. It's the second in the Ask the Therapist series. So before I get into what the actual question is, I just want to put a quick disclaimer out there that this is not a suitable replacement for any mental health care. And if you're experiencing mental health concerns or behavioral concerns, please talk to a therapist or a mental health provider that you trust and take care of yourself. So without any further ado, the question for today is, if you're crazy, do you know it? And I was really interested in this question and trying to figure out what the person who asked this question, since it is anonymous, what that person meant by the word crazy. And so first off, just to put a disclaimer for myself out there that I try really hard not to use the word crazy because it is offensive to some people and I don't want to offend anyone. That's not my intention at all. So I'm going to use the word today because it was put in the question as a quote from the question. If this is something that people would like to talk more about, of why the word crazy is sometimes offensive, please let me know and I can do another video on that. To get into the question and if you're crazy, do you know it? First, I want to put some context around diagnosing in the first place. That really there's a lot of differing opinions on if a diagnosis is correct or not. So for example, I have here the DSM-4 and 5, if I can pick them up. So DSM-4 right here, which most people are still using, and then DSM-5, which is starting to be used as well. These books basically determine, I'm going to quotes, determine what is a diagnosis and what is not. And so the reason I put quotes is because the books don't appear. They are written by people who have biases and who have different opinions. And so the whether or not a person meets a criteria for a diagnosis could change within a couple of years. So for example, the DSM, I think it was DSM-3, which was being used in the 70s. In 1973, the mental health community, as a consensus, not a full consensus, I'm sure, but the mental health community decided to remove homosexuality as a diagnosis from the DSM in 1973. So prior to 1973, if you were gay or lesbian or bisexual or pansexual or really anything that wasn't one sex attracted to one different sex, then you would be considered as having a mental illness, which of course is now not the case. And so I just want to put some context around that just because a book written by some people says that there's a diagnosis doesn't mean that you are crazy. So I made a little, I'm a visual person. If you're a client of mine, you know this all too well, that I'm a visual learner and I like to use lots of metaphors. So this is a little diagram, hopefully you can see it, about the different types of diagnoses. So there's neurotic and psychotic. So most people who are diagnosed with a disorder fall under the neurotic category. This is all mental health, by the way, the mental health umbrella, if you will. And so really the big difference is that people who have a neurotic disorder, that could be, for example, depression, anxiety, OCD, ADD, ADHD. These are diagnoses that influence how you feel day to day, but they don't stop you from doing basic human functioning. They don't stop you from eating. They don't stop you from bathing, from socializing. They might make us nervous to socialize. They might make us stay in more often, but they don't prevent us from meeting our own basic human needs. Whereas psychotic disorders, you can see here that there's impaired thought, perception, and judgment. There's often hallucinations, paranoia, delusions of being someone that you're not. Most of the time, a psychotic disorder prevents someone, mostly temporarily, from being connected to reality. So an example, the most common example of this is schizophrenia. So most people, if you are diagnosed, which by the way, there's 18% of American adults, of people in the United States that were adults in 2014 were diagnosed with a mental disorder. So 18, that's a lot of people, 18% of the entire country. And that's just the people that actually go to someone and get a diagnosis that's formally put in a medical file and reported to, I think, the National Institute of Health is where I got that. I'll post it. So there's probably way more people that are diagnosed or have a mental illness that aren't officially diagnosed. The consensus is from a lot of psychiatrists that I've heard talk about this topic is that if you're asking if you're crazy, you're probably fine. That people who have psychotic disorders, who are not in touch with reality, it's really, really hard to convince a person experiencing hallucinations and delusions that what they are experiencing is not reality. That's a very, very difficult thing to do. And so if you're asking the question, am I sane or not, you might have experiences with depression or anxiety. A lot of people going through panic attacks think that they are going crazy in that moment. So if you do think that you have a neurotic disorder like depression, anxiety, know that you're in a good group of people. I mean, most people experience depression or anxiety at some point in their life. So if you are thinking that you have meet some of the criteria for a mental diagnosis, please see a psychiatrist or a therapist that you trust again. And just talk to them about what your experience is and find out if you do meet the criteria for a mental diagnosis or not. Like I said, oftentimes we experience criteria for a diagnosis, but maybe not meet all of the criteria necessary. So you could have symptoms of depression and not actually meet the diagnosis criteria for depression. So hopefully that answers the question. And if you have follow-up questions or a tangential question from this one, please email me or just go to my website and use the contact information there, and I'll get it that way. I wish you all the best. Be kind to yourselves and have a wonderful day. Bye.